Thank you, Jarata, for that beautiful welcome. I'm so glad that more than 5 people thought this was a good idea. Whenever you're dreaming up something new, you always wonder if it's, something that you have in your head and your heart, or if it is something that would resonate well with all of us. So I did not do this dreaming in a vacuum, but I did want to take a minute to say this work takes not only brains and knowledge and discipline, but a lot of heart. And each and every one of you here today is a global leader in this space. And we need all of your voices equally today to be raw and honest about what isn't working. We have so much great research, a lot of community of practice. We heard from Dr. Schiffman, Jenny Knoll, about some interesting challenges they've faced, interesting, diverse thoughts and ideas of how we need to maybe start to think a little different. Rising up from our own individual disciplines to be brave enough and to be willing to hear and listen, as Jenny told us, was one of the key things that she had to do when she started to take on unpacking the community in Penn State after that devastating loss. Each and every one of you probably carries with you every child, every experience that you've had where you tried to help somebody, tried to help a family, did some impactful research, and wondered, why am I, of these 15 downloads, is it only me downloading 15 times, or my mom, or why are people not seeing this? Why are we not taking more action and taking that research to action? So ISPCAN is a really unique organization, and as you look across the room, I hope, experience over the last 3 days why. How we come together, the networks we build, the friendships and the trust, so that we can be a bit raw and we can think a little bit bigger about what it is that we're doing, and how every country, as unique and beautiful as it is also really similar. Similar in the challenges, similar in the people, the families, the social determinants of health, all of the things that you worry about in your nation. Every nation is feeling it. So this new community of learning and practice for governments to be invited to the table, to be welcomed, to be heard, to help them. I truly feel they have one of the hardest jobs, to try to bring children in their country to their potential, and we have to help them. So we don't have any more time to waste, and I really hope this becomes a start of something special where we can brainstorm and mastermind this together. So thank you for being here, and I just wanted to talk a little bit about what we're doing here today to set the scene about this approach we're taking and why. Some of you have heard a little bit of this, some of you are new to the public health conversation and come from different various perspectives. So I just wanted to briefly review why we're here. This new Rise Up Policy Forum is something special that we are creating because we want this to be a new forum where people, all of us, can really sit around the table and have an equal seat and think and talk and share openly and honestly about, again, why things are not progressing fast enough. I love this quote by Antonio Gutierrez, who I think it really says it well. In a world where all problems are global, there is no way countries can handle these issues by themselves. We need global responses. To every major crisis, including child protection, we need to take this attitude and response. We all know this, but just to reemphasize that childhood violence is the most costly public health issue in the United States and globally. We know that 1 in 2 children experience violence, and that the ramifications of this is just immense. short-term consequences, long-term consequences that cripple communities and societies. The only way forward through this is through prevention. And we know that there is a return on investment for this type of work. This is a pretty typical public health. How many public health people do we have in the room? My people. I love it. I mean, all of you know this slide, but for every health issue, we see what's on the surface. But what's lurking under the surface is actually what's much, much more scary. It's coming at us, and if we don't take the prevention, the attitude of prevention as being our primary focus, we will never get ahead of this problem. We need to be more intentional about with what we're doing in every sector so that we are developing healthy, productive citizens that can reach their full potential. Because when we're just responding to that iceberg as our boat is coming closer, yeah, we're dealing with some of the problems, we're enforcing laws, we're trying to bring perpetrators to justice, and this is also very important to obviously help people who are experiencing childhood violence and neglect. But imagine if we start to think about and plan ahead and steer the boat a little bit around the iceberg, we could avoid so many things. So this public health framework in child protection is, again, about bringing these sectors together to collaborate. It's a really critical piece of the puzzle. Early intervention is really key for successful outcomes. And of course, we must have data-driven strategies so that we maximize resources, put money where it's needed and where we know it's going to count, and human effort where it's going to make a difference. Community engagement is the most important piece of this puzzle in addition to government action, because that engagement is going to only strengthen in every place this response. So this public health model is really about being proactive. We have to assess and intervene early. We have to use research-based evidence and best practice. And most of all, we have to prioritize universal screening, service, and delivery platforms, because this is the way that we are going to get ahead of detecting and responding to everything that is coming towards families and children. So in essence, this pyramid should be flipped upside down, as it says, because if we invested the other way around, instead of the way that we currently do things, we would actually have a chance to get ahead of that iceberg. On the funding side, we know economists have calculated this. We know, and we'll be hearing more from our UN partners from the SRSG's office today about the investment case, but every dollar invested in high-quality programs right now, things that help make families and children more secure and stable, is going to save us about $7 to $9 on welfare payments, healthcare costs, all of those ramifications we saw in the earlier slide, substance abuse, incarceration, and most of all, quality of life improves for your entire community, for the country. A nation's GDP is better, and we know that this will all pay off. But I want to be a little raw and honest today, too, because we're not perfect. We are making a lot of mistakes, even as organizations. What was so interesting to me is the framework on the right has been going on and being delivered by UNICEF for a few years. I've never seen it until I started talking to my partner, Stephen Blight, at UNICEF. We are all working in these silos. And what was so interesting is that my CSO partners and I came up with this other wheel that we are using now, the 6 pillars of public health prevention, before the Global Ministerial Conference. And look how much they almost match. But I had never seen it because we just don't talk to each other enough. We're all so busy in our little wheel, running the rat race and taking care of what we can with our 4 staff members and tiny budgets and Sometimes we are part of the problem, is what I'm trying to say, too. And I think there's an honesty that we need to bring to this conversation today to really think about how much we are creating some of these silos and not really thinking and looking across at what others are doing. And how can I maximize that and work with you and collaborate? So some of these really important key themes are going to come through today. And hopefully it just really makes us all start to wake up and do it a little different. And this is a really tried and true public health model. It doesn't matter if we were talking about vaccinations, fluoride services for tooth decay, tobacco cessation, and most recently COVID. Look how our global response to COVID locked it down in, I don't know, 2 to 4 a year, depending on your government, how the response happened. But it's a tried and true model. And if we were to take this approach, we really could start to think about child protection maybe in a more effective way. But I do want to call attention to what that little circle in the middle says about system management. System management. So what does that mean? Does that mean in one country, maybe the Ministry of Justice is managing this system? In one country, maybe it's the Ministry of Social Affairs. In one country, maybe it's the health sector, we hope, maybe. But imagine if the system was managed by all the ministries. Maybe we could actually get somewhere. So I just want to take you a bit through the journey of what our partners and what we have been building together so that you have a little bit of a understanding depending on what sector you come from. But this global ministerial, was put together by World Health, UNICEF, the UNSRSG's office, and ISPCAN played a critical role in helping to bring this forum together because it was timely and we needed it to start to shift the way ministers thought about child protection. And last November, they came together and really tried to think, how do we do this? Now is the next question, though, because ministers made a lot of pledges. There were 388 pledges total made. 106 countries were represented. And you can see the global distribution. Pledges were made in different sections of important initiatives, different things that we felt were key important pillars of action, some quick wins that we thought had the most evidence base behind that have important effects on children right away, parent and caregiver support, safe and enabling school environments. And countries are trying, they're thinking, they're starting to move the wheels. But how do they get there? These pledges that they make, we don't want them to just be another piece of paper, another declaration, right? We got to make sure that things start to move in an interesting way. But to help governments get there, and how do they do this? It is going to take coordinated action from all of us to think about, as ISPCAN members, NGOs in countries, how do we bring technical frameworks together, government systems, and learn how to use that data that we have so that it isn't just another published article that you and your mom are reading. It's got to be more understood, more applied. And the investors in this sector have to understand that we've got to really fund system strengthening so that countries can become independent and sustainable in their actions. So I hope this Rise Up Policy Forum in the middle may bring together these unique pieces of the puzzle so that we can build a community of learning where everyone gets the information they need and maybe starts to think about things a little differently outside your individual workflow. So our UNICEF partners have been doing this system strengthening work, as I said, for the last few years. And as we started to think about and develop this Rise Up Policy Forum, we have been consulting with all of our partners, having lots of individual meetings, trying to collaborate on this vision. Like, what do we need? What do we got to do to get here? Because it's not that obvious, and we have to really collaborate and join hands. So it's interesting to see how countries self-report their progress in every one of these different regions. And all of this information, I will provide the links for this so that you can see afterwards the details. But this gives you a quick snapshot of the 158 countries reporting, how many of them feel like they are in the initial phases of system building, how many of them feel like they're maybe in the middle phases, and the more advanced phases of system strengthening. So this theory of change happened over the last 2 years, and I really have tapped on experts in ISPCAN, data, practice, the Inspire Working Group, the CSO Forum, our Najat's office, all of the World Health headquarter and regional offices, UNICEF's, our country partners, all of these people who we have such strong relationships with, we are talking and really thinking this through and consulting with each other to think about how do we row in the same direction and help people to understand what's needed and work together to accomplish this common goal. And when we think about helping countries to improve the foundations of their CPS systems, there's an order that we see bubbling up that might be the most effective way to, one, create who's controlling the system, that middle wheel, and then how that multi-sectoral thought and leadership could flow through policies and legislation, making sure those are set up right and are thinking about multi-sectoral coordination through data collection, through response, through prevention. Then that governing body could also ensure child rights and making sure people had universal access to care, advancing data, investing in national action plans, capacity building, and then last but not least, all of these are equally important. It's just that with any process, sometimes there's a practical way to do it that's going to make sense and be long-lasting. So the last one is about making sure that we have that voice of the child and survivor and understanding what outcomes are really working.